That was a yes.
Okay, thanks, Catherine. And I'm a yes.
Ross will be joining shortly.
Okay. Item C is public comment. Is there anybody in the public? Okay. Item D is the approval of the minutes from the November 29th committee meeting. That's on pages 2 through 4.
I'll make a motion, we accept them as presented, or as presented.
Okay, Director Parks motions to approve. Is there a second?
I'll second, John.
Director Clark. Director Parks, your vote.
Yes.
Director Clark.
Yes.
Director Elconin.
Yes.
And I'm a yes. It's 4 votes yes. Moving on to item E is the project update, and that's on page 5, and we'll refer to Mr. East. Welcome.
Thank you. Okay. So, all right. So under the master plan, the plans, as you saw on my little update letter, the plans have been resubmitted to HCI. They were submitted on December 15. So we are in first back check on our drawings. So they show a tentative schedule of kicking out even a couple of weeks earlier than we show on our schedule that the architect and I put together, but it's still, they're going to still have it for a couple of months. So for this go around. And so, and then of course, as part of that, the FEMA grant application, we had submitted it to Cal OES. They kicked it back to us with a long list of corrections. We did all the corrections. They had their consultants go through it. We did all of those corrections. We submitted it again. They went through it even with a more fine tooth comb, and they kicked it back a second time with a smaller list of things that they wanted us. They said basically, even as it was submittable, but they said, if you want to make these few last corrections, it'll be even better. So we went through and we made all of those corrections, and they are all uploaded. They are not submitted only because the person who has to submit is Kern County. And Kern County decided to basically close through the holidays, so they are not open. But we informed Cal OES of that, and since they are not submitting to FEMA till the end of January, it's a non-issue. So as soon as Amanda, I think her name is Amanda Blinks, gets back at the county next week, we will get her to push that button to hit the actual submit, but everything is done.
Fred was asking if we could get a copy of the board members to take a look at the detail that's in that.
It'll take us a little time to print all of that out. Yes, we absolutely can. The sub application is in somewhere in the neighborhood of 20 pages. And then there's about 100 documents that back that up that are about a total of about 600 pages. Do you want it all?
What I was looking at was the emergency preparedness plan.
Oh, you were looking at that one, which we said is gonna be delayed till next month.
Right.
We're talking policy.
This thing here that you want.
Okay, I thought you were talking about the application.
No, it's the EMPPP.
Oh, okay, all right, okay, complete separate.
Yep.
Yes.
Yeah, well, because just the Kern, one of the attachments is Kern County's emergency plan, which is, like the book A is 460 pages and book B is like 100 pages. Plus then we have another 50 or 60 documents attached to back up all of our statements on as far as the FEMA grant.
Well, clearly I'm bored, but I'm not that bored.
Okay. I have read that also. It's very riveting stuff. Yeah. Anyway, all right. Okay, so that's, I think, where we're at on master plan, unless there's any questions related to the master plan.
Not for me.
No.
Yeah, Ross, we're on master plan, moving on to SBC.
Page 5. Yeah.
Page 5.
Thank you. I caught that. Thanks for starting. I apologize for being late.
All right, so on the SPC 4D, you folks have attached, okay, so what I did is when I put it out to bid, I then called 9 companies in the Bakersfield, Fresno, various areas to see if they would be willing to bid. And we came back with 3 or 4 that said they would bid. The other one said that it was outside of the scope of things that they would normally do. But when it came down to the day of the actual bids due by 2 o'clock in the afternoon, I had 1 bid that came in just before 2, and it was from Twining. Twining is a very reputable, very well-known testing laboratory out of the LA area, but they do have a branch in Ridgecrest, which is close enough for them to service this project. But we only got the 1 bid, and I actually expected Twining, and they expected to be high, but since no one else bid, they are the only bid. Only because, well, what the guy told me is he says, we basically do all the work for China Lake Naval Weapons Center for all the rebuilding of all the structures and stuff that they're rebuilding out there at China Lake. And he says, we're not the cheapest in town, but he says, you know, we are very competent. And so I have known of their name, and many hospitals use Twining as their testing lab. They're a very reputable firm. So we only have 1 bid. So that 1 bid is for $120,876.25.
I know that listed further down on the agenda. This was just for the project.
Oh, I'm sorry. Okay. So let's step back. So we're not voting on that right at this point, but what I do want, okay, because that's on new business. I'm sorry. What I do want to say though, is I got approached by HCI. I got approached by a Carl Sherman. He is with the seismic division of HCI, and says that he said that they have received money from one of the smoking taxes. I forget exactly which one, but he says this is a substantial amount of money, and what they have earmarked that money at HCI for is to help out small acute rural hospitals with the preliminary work for their seismic upgrade. So the process of applying just was very simple. I went ahead, there's a new tab on the HCI website for rural hospitals. I went onto that site. I submitted an application for those funds to hopefully cover this amount. One of the requirements, and there's a policy intent notice from HCI PIN number 71, which gives you the process of applying, and it did require having a current plan, seismic upgrade plan. And our plan that was on file was actually done, I think, before Tim was even here, and it was seriously outdated. It had basically building a new acute care hospital on the front lawn, which obviously was supposed to have been completed in 2013. So that plan was a little outdated. So I put together the new plan exactly of what we're doing, and I submitted that to HCI. I received a notice that they had got it on December 6th, and thanking me for my submittal on that. He did call me late last week, and we spoke again this morning, and there was 2 minor corrections that he needed done on that. One was just that I had put a wrong OSHPD HCI number in the verbiage of one of the lines sections. And the other thing was they wanted the site map attached at the end of the document. So I did that this morning and resubmitted it to Carl. And so we are good to go. He says they hope to be able to be awarding some of this money in like March, possibly. It is based upon once our whole submittal is approved, which is in the review process now, we pay for the testing up front, and we submit our invoices, and then they reimburse us the money. So it's looking pretty good that we will get this 120,000 possibly paid for by these funds from HCI. which will be nice. And so we're relatively early in the process. We are application number 7 with HCI for funds. So
That won't disqualify us from the FEMA money, will it?
absolutely not. This is the 4D testing is not in the FEMA application.
Okay, all right,
So it's
Good.
completely separate
Wow.
project with a separate HCI number.
okay, excellent.
Bob,
Yes.
are we compliant by only having one bid? The fact that we sent all of them out make us compliant?
Yes, because it went out to public bid. And, we followed all of the legal procedures of doing so, and everybody received the RFI, everybody received the drawings. Yes, we are okay with one bid,
Okay.
which we'll get to a little later here on the agenda as far as whether we're going to approve it or not. So that's where we're at with the 4D testing. The good news is it may very well be paid for.
Cool. Thank you.
Yeah.
Okay, go ahead and proceed, Bob, on to new admin building.
Okay, yeah, here's the fun one. The floodplain district has reared their ugly head again. So on this latest plan review, they have basically stated that in order to proceed, if we want to try and stay under half the value of the building, 1, we have to get a new appraisal on the building. And 2, for the scope of work, we have to get 3 bids from contractors for that scope of work. Which, anyway, so this, where I discussed this with Tim, what I think we need to do, and of course, obviously the county is closed until after the first of the year. I believe we need to have a meeting, and I don't know if it's with the head of the building department or building and planning, somebody fairly high up that is over and above the floodplain district, and basically make a case that everywhere else in Kern County, they follow the FEMA guidelines in floodplain, except for Mountain Mesa, where they have this person who has passed away, who used to work in the floodplain district, who did his own personal study, and they have decided that it is gospel truth. They've lost the study, but they do have a little map that shows the depth of supposed water flows. So I believe it is time probably for, maybe Tim and I and Ross to go meet with someone at the whoever we think is appropriate, and plead our case that Mountain Mesa follow the FEMA guidelines right along with 99.9% of all of Kern County with the building department.
Everywhere else, you've got a 100-year floodplain. This
Yes.
guy created a 500-year floodplain.
Or even worse, I don't even, well, without the study, you can't even prove that it's even justified.
Bob, could you take our supervisor with you? The supervisor is his boss.
Yeah, we talked about that, and we didn't, Gene, we were looking at it from the perspective, do we really want to go that far over his head just yet? We thought we'd go to the department head first to see where we could go, and then if we didn't get anywhere there, we can always go bring the supervisor in afterwards.
Yeah, I'm thinking at least the head of building and planning.
Yeah.
Meeting with the floodplain is a waste of time, because I've met with them multiple times and they're just basically saying, this is it, you don't have any choice. You must follow these guidelines for Mountain Mesa. So we need to go to the head of all of the building department, I believe, is probably the place to start, and then maybe go up from there.
So I think your strategy is good. I think we should probably meet with the Director of Public Works. I believe he's over the floodplain people.
Yeah, I'm not exactly sure of the hierarchy, but yes.
Yeah, and the Director of Public Works answers directly to the Board of Supervisors. So he's going to be the one that's going to be most responsive to us.
Good.
Okay.
Okay, thank you.
Yeah, well, and one reason I believe we need to make this go away is because of the change in stance from HCI. Before, HCI just basically disregarded local jurisdictions because it's the hospital. But now they've made me in the last 2 projects submit drawings to the planning department of Kern County. And as long as the scope is within the hospital walls, it does not have to be submitted to the Kern County Planning Department. But if it's got scope of work that's outside of the building, they want the county's blessing on it. Well, if this ended up getting trickle down to the floodplain district, they could throw a big fit because of our new canopy out front and the canopy out back of the seismic upgrade. So that's why I think this needs to be put to bed now.
Yeah.
So,
Yeah.
One thing on the appraisal, we could be very favorable doing it now. Dr. Wagner sold his building, and I don't think he sold it cheap. And so that would be a very good comp and possibly could bring ours up where we want it.
well, yes, and if we do need to go down that road, obviously having the highest appraised value would be best.
Right. And so I didn't ask him how much he sold it for, but I know he got a good buck for it. So it could be advantageous to us.
By the same token, I want to get a low appraisal when I do the building.
Yeah, on the Leho building.
Yeah.
The property behind us.
Yeah.
Yeah. All right, so that's where we're at on the admin building. It needs to wait a couple of weeks and then we need to arrange to have a meeting.
We'll set up with that meeting. I would definitely, I would love to be part of that. I want to be in that room. I want to tell them how ridiculous they're being.
Yeah, all right, sounds good. Okay, so I spoke with the architect last week on the emergency generator project. We have merged the generator failure project with the generator project. And the drawings, the revised scope of drawings that you requested for me, they thought they would have it done by end of December. Now they're talking first or second week of January. They were real busy getting the corrections for the seismic project back to HCI. So the generator project slid a few days. So I expect to have those drawings early to mid-January, and we'll get that out to bid, ASAP, and hopefully we'll get some better numbers.
Get some more numbers.
Yeah, more numbers, more than one. And now that the price of copper has gone down, maybe some better numbers. Okay, and the train boiler chiller project is still on there only because we are in process of closing it with Oshpod. All the information has been uploaded to the e-portal, and we've been in back and forth emails with Bruce Bigger, and we're very close to him pushing the button that says that's closed in compliance. And let's see, train boiler chiller project. I'm sorry, I've just reported on that. Dietary water heater. That project is complete. We pulled the second water sample required by HCI to test for bacteria. We pulled that sample this morning. The work is done. I've arranged for the startup company to come and start the unit up and get it fired up. I believe they will. I didn't get it on my schedule, so I got to double check on it. It's either at the end of this week or it's the first part of next week. We'll be starting that up. And then at that point, we will file all the closing documents with HCI on that project.
That's all been pressure tested and.
Pressure tested, yes.
Chlorinated, the whole thing, yeah.
And it's been chlorinated. We did, oddly enough, it passed 3 pressure tests and then it sprung a leak yesterday. So we're dealing with a very, very, very small leak. But anyway, just one of those frustrating things. But anyway, it's filled with water. It's got all the testing has been done. 24 hours from tomorrow morning, we should have blessing on the second test.
Good.
And then the company will come out and program it and start it up and verify propane pressures and all the various things that they have to do to program it to work properly. And then we'll be able to put it online.
So now the pressure's on you.
Yeah, that's right. And Pharmacy HVAC is just there because we haven't received the letter from HCI saying the project is closed in compliance, but everything is done. And just waiting on that. HCI is just like the county. They kind of shut down through the holidays. A lot of people are on vacation. So taking their PTO before they lose it at the end of the year kind of a thing. So things are moving slow. They'll pick up in January. All right.
Thanks, Bob. Questions or comments before we move on? Okay, then we'll skip F since there are no invoices for review and go to G, which is Twining. And so we got this one bid.
Yes, it's not outrageous, but it's, it'd have been nice if it had been 95,000, but
What was your estimate?
I didn't really have an estimate because it's really hard to determine because they have to go to, I think it's 4 sections of the CMU walls. They've got to remove sections of the cement block, complete with rebar and the concrete fill. It has to go to a testing lab. They've got to break it. They have to then come back and enlarge the opening and tie new rebar in and then fit in new CMU block and repair all the damages. They have to core the foundation, and I think it's 3 locations. They have to evaluate the wood truss or the wood rafters of the building. There's just a long list of things that they have to verify the condition of, and whether when it was built, whether the concrete got hard enough and that sort of thing. So I'm not, this is not out of where I expected it to be for the amount of scope of work. Originally, we had gotten a price earlier on that was a good bit lower than this, but the amount of tests were a whole lot less. And in the negotiation with HCI, they basically doubled the amount of locations that they wanted testing done, which then, of course, doubled the price.
Okay.
Can I make a motion? We accept the bid.
Okay, we have a motion. Do we have a second?
I'll second, Ross.
Is there any more discussion? Any questions or comments before we go for a vote? Does any member of the public wish to be heard on this item? Okay, then we'll go to a vote. John,
Yes.
Fred,
Yes.
Catherine,
yes,
Jean,
Yes,
and I'm yes. No, thank you for taking care of that, Bob.
Yeah, and then, and hopefully if, we'll find out probably in March or April, but it may very well be paid for by HCI, so.
Super.
And the smokers of California.
Okay, so item H, the auxiliary thrift store flooring bids. Bob?
Okay, so the carpet that is in the thrift store, from what I've been able to research, appears to have been installed when it was the boat shop, which was a long time ago. It is in very bad shape. It is delaminating in multiple areas. So the carpet it's a glue down carpet. So it is delaminated from its backing. So it's got these ripples in it. It's a trip hazard. It's really in poor shape. So, Tim asked that I get some pricing to replace the carpet. The way we will go about it is we will, my staff and the thrift store staff will work on shifting as much of the stuff to one side. And the flooring company will come in and do half the floor. They will strip it, lay the new. We're going to go back with carpet tiles, probably very similar to what Greg, we put in your clinic, and all the carpeted areas. 2-foot square carpet tiles that are commercial. They will never delaminate. It's very good quality. I asked them to basically bid a mid-price carpet tile. We haven't chosen the actual carpet tile. I thought, well, with approval, I asked them to bid a mid-priced carpet tile, not really high end, but not inexpensive. So they will then give me samples. I will get that approved for the color choice that we're going to go with. But anyway, they'll do the one half, and then we will shift the racks and things that we can't get out back or into the C trains to the other side of the room, and we'll do the other half. And then at that point, we'll shift all and bring everything back in. And then the volunteers will need a number of days to get all this, everything restocked and looking good and ready to reopen. So I've not had much luck with any locals. So I reached out to 2 of the bigger firms in Bakersfield, which is Bakersfield Floor Covering and Jost Flooring, and they both provided a bid. Jost Flooring was about $4,000 $4,008 higher. They're both reputable firms. I've used both firms
Hey, Bob,
over the years.
locally, who did you contact?
I did not, this time I did not contact anybody locally because
Well, you just said that you contacted local, but no one got back to you.
no, I'm sorry. That was not what I meant to say. In the past, I have reached out to Lake Isabella Flooring and I was told they were not interested in doing any work for the hospital. Just absolutely adamant. I do not know the person over in Wofford Heights. There is a small store over in Wofford Heights. Did not reach out to them.
Bob, could I ask a question? Companies like Walmart and Costco and all of them have gone with just plain cement floors. Is the flooring good enough to do that?
Not having pulled up any of the carpet, it's hard for me to judge, but I will say this. One, you would still have to pay a company to strip all the old carpet out. Then you have all of the glue that is adhered to the concrete from the glue down process. So they have to use an emulsifier to soften the glue and scrape up all of the glue on 4,500 square feet.
Yeah.
And then you have to bring in grinding machines to grind the concrete down smooth. And my understanding is that process is substantially more than just putting down a good quality carpet tile.
Okay, so, but we have waited and looked at it. Okay, thank you.
Yeah.
Well, plus I think it would make the building too cold in the winter.
And if you have some of these older folks trip and fall, now they're landing on concrete versus a padded carpet.
Now, I know what you're
Flip
talking.
potential too.
Yeah, and slips.
Okay, thanks. Thank you, Bob.
Yeah.
We had talked about that, Gene, because I know that we had talked, you and I, Bob, had talked about that some time ago,
Yeah.
about just going down and putting a painted floor down there, but more we look at that and so forth and talk with them, that kind of went by the wayside.
Yeah, that's not being, we originally looked at it, the thrift store staff were interested in that option, but then they got to thinking about, the people that they do have fall and, whatnot, and they're more likely to be injured if they fall on concrete than if they fall on, a commercial carpet.
Right.
So
It's a-
Bob, your proposal then is to go with the Bakersfield Flooring Company, the 22.5? Is that your recommendation?
Yes, this firm is very competent. They do a lot of schools. They do a lot of commercial work. They do most of the hospitals in Bakersfield. Very competent. They will bring in large equipment that will strip that carpet out in no time at all. It's not going to be all hand scraped up. But if we hire, a local carpet installer, they're not going to have the kind of equipment that these firms have.
Yeah, but they're not doing it by hand either. I know. I just had a bunch done.
Yeah. I've
But
done it myself too.
with the price of these bids, do we have to send it through the normal process? Because obviously one of them's over the $25,000 mark.
Yes, 25,000 is the threshold that would require us to make this a prevailing wage, put out to commercial bid. But if we go with a lesser price, it is under that threshold.
Okay, do we need a motion to approve?
We
that?
do.
Okay, I make a motion, we approve it as presented by Bob.
Okay, we have a motion. Is there a second?
I have a question.
Sure.
Go ahead, Catherine.
Should we not approach the local businesses again?
What we could do.
I don't know why
Catherine,
we didn't to start with.
I
Sorry.
have to say, what we could possibly do is approve it at this level. If we go to the local person and it is equivalent or less, then we can either bring it back or we can just go with a lower price, but at least we locked in the dollar value of that. And like I said, again, based upon the way they communicated to us the last time, They weren't interested in all, but I have no problems going back and just asking. But
Can I ask how long ago that we had approached either one?
I have not, I do not even know the person in Wofford Heights. That's a relatively new store. It's been several years since I approached Lake Isabella, but the owner was extremely rude to me. Basically told me to go fly kite.
Okay. Well, yeah, I think we can approve the prices, but I would like to see
we lost
vendors approached.
I'll amend my motion to include what you're saying.
we lost a little bit of what she was saying there. So I'm assuming you're saying you're going to go ahead and approve the price, but we'll go back and check with the local vendor just to see whether or not they can do it at equal to or less than.
Correct.
Okay, got it.
That's what I wanted to amend my motion to.
Thank you.
I'll second Ross.
Okay, so we have a motion and a second on the amended motion. Yeah, any other discussion or questions? Are there any members of the public wishing to be heard on this item? Okay, then we'll go for a vote. John, your vote?
Yes.
Brad?
Yeah.
Jean?
Yes.
Catherine?
Yes.
And I'm also a yes. So we will let us know on this, what you find out, but obviously we authorized the 22.5 with that Bakersfield firm unless we have a more attractive offer coming locally, and then we can discuss.
Got it. Thank you.
All right.
Okay, and we are to item I, exploring clinical services in Lake Isabella. Mr. Davis.
So I just wanted to update on, because I know that Tim's, talked about, their initial conversations with the school districts and potentially having an additional site in Lake Isabella. Just kind of wanted to sum up with a lot of the things I've been involved with this. We've been providing services on the school campuses for the past 2 years. Almost everything that we've been doing has been mental health. Basically, Lisa Wiley is going to both South Fork and Kernville. She's going to Kernville. By Kernville, I mean the Lake Isabella campus. It's Kernville Union School District. But she's going there every week. To South Fork, she's going every other week, providing some bridge services for mental health needs that they have. The school really would like us to be providing more clinical type services, immunizations, well child checks, sick visits, that kind of thing. And that's really disappointing for me because we haven't been able to do that because of our staffing. We're so busy right now. If I send someone out on the mobile clinic, we won't be able to see enough of our regular patients. So that's been a big struggle. So kind of going back to the school's involvement, the Kernville Union School District was one of, I think, 9 in the county that was approved for what's called a community schools grant, where it turns the school district into a hub for the community. So bringing together healthcare service, mental health services, supportive services like services that are provided for at the Family Resource Center, faith-based organizations, people that have food pantries, just bringing all of this all together. So we actually had our first, and Tim talked about this at the last regular board meeting, I believe. Lisa Wiley and I attended the first meeting. It was on December 2nd with the school district. And I mean, there was representatives from the high school, law enforcement, social services, Heather Berry. There was even South Fork Union Center representative. So a lot of people from the community were there, and we're basically looking at, what services are available now. We're going to be meeting again on February 3rd. For kind of a follow-up on that, and actually start working on actions on how we can increase services to kids, to families, to the general community as a whole. So, we've known for quite a while since, Clinica closed their their site in Lake Isabella. There's no healthcare being provided other than chiropractor is the only healthcare that's really being provided in Lake Isabella. And so basically anyone from Lake Isabella, Bodfish area has to either come out to Mount Mesa, go up to Wofford Heights or Bakersfield. And with absent busing in the community, this has been a big problem. The part of this grant involves developing a wellness center within the district. So we're looking at various solutions that could kind of bring a lot of services all together. You know, the district office used to be on campus. They recently, moved off campus, have their own site. The Family Resource Center, was down on Lake Isabella Boulevard. They have another site. I haven't actually been in there yet, but they're running low on space. So, we're actually starting to explore, potentially if the healthcare district is interested in pursuing this, developing kind of like a center where we'd have like a family resource center, a district office, potentially mental health services with the district, healthcare, an actual rural health clinic, and potentially we can even expand that into dental services and, dental services in the Valley. If you're on Medicaid, Medi-Cal, then that's pretty much non-existent. So we wanted to, really look at how we can start bringing all of these things, together in a tangible place, something that's easily accessible for the community, easily accessible for students on the campus, just as a community resource in general. So we actually met Steve Martinez, me, Lissa Robinson, Marie Sampson, and a resource company, Ross, you'll remember, Government Financial Services. We kind of had a Zoom meeting a couple weeks ago, and we talked about potential solutions, and the representative from Government Financial Services has recommended that we actually start looking at some potential sites, because the district already has some leads on some sites. I know the hospital has some land available, so we're kind of get together the first week I come back. It's I think January 5th. We're getting together. We're going to look around at sites that would kind of meet all of our needs. So it's kind of exciting thinking about that possibility. It's not something that we're committing to, because I don't know that we can commit to it. The biggest concern I have with a program like this is kind of what we've experienced to a certain degree with the mobile clinic is lack of providers. I know that we can easily open up a clinic in Lake Isabella and have very full schedules right away. The downside of that would be that it would be draining from, the patient volume at our existing site. And so that would be painful initially until we, hire other physicians, PAs, nurse practitioners, et cetera. So, I haven't actually talked to Tim about this yet, but I did a physician interview a couple days ago with a physician who's been in the Midwest for quite a while. Her daughter moved to California, and she wants to be kind of near her daughter, but not right next to her daughter. So she's actually going to be coming up on Thursday, the second Thursday of January. So that one is really exciting. She has a lot of experience in primary care and research. So she's looking at starting to do some primary care services. So we definitely have some things that are moving, but I hope this one kind of follows through. But if we were to do something with the district, there's a lot of different models that could happen where we could have adjacent sites where we would have our own thing, the district would have their own thing, potentially in something, because the school has access to some funding that we don't. We could look at the district actually building something new or retrofitting an existing building that would add services like but kind of like how we need them to be provided. What I mean by that is the OSHPD 3 or HCI level 3 building stuff. So I did send that to the district, let them know what some of our requirements would be. So the district has potential for some land that may be donated. There's the potential for purchase some existing properties. So I don't know, I'm kind of rambling on, but I just wanted to update on where things are and kind of get some feedback from you all.
Greg, we obviously have our lot across the street from the thrift shop. I spoke with Dr. Ahmed last week. I had an appointment with him, talked to him about the project and the possibility of maybe him doing something with his building there and putting those two lots together. He's very interested in doing something, if that's something that might be beneficial to the project.
That is one of the locations. We did talk about both the hospital's property and his property. So that is one that we're going to look at. And basically what we're doing is we're doing a little road trip. We're getting everyone together in the same vehicle so we can go to a whole bunch of different sites and look at some of the properties in town that, are kind of eyesores, but could be a good resource for us. So it's exciting. I just don't want to do too much too fast, and potentially, even if the district would move forward, but we weren't ready to fully commit to a program like that, we could set it up so there's a place for the mobile clinic to actually go where it's easily accessible. There could be maybe a waiting room adjacent to the mobile clinic, and then they could easily walk in. So that would be a temporary solution, because it's a process for opening up a new rural health clinic. That process would require a consultant to really do it right, to make sure that we get the best rate, because we need to have the right PPS rate. And so, we would definitely want to look at that, but it's a long process. The reason that we got the existing mobile clinic certified so fast is because of COVID. With Jean Chang asked what we could do to increase services, and told her, certify our clinic. The application's in, it's just waiting for your rubber stamp. And she came up within 24 hours, and they surveyed it and passed us, and that saved us almost a year of services. So exciting. But
so Greg, the question on this, the concept, I think, is really exciting. The potential here is beneficial to a huge segment of our community, and so I understand that. It seems like from what you're describing, there's a couple things. One, our biggest stumbling block is personnel. How do we staff it and not take from the clinic, from our rural clinic, and shoot ourselves in the foot by providing services when we're not providing the care we need to in our own backyard. So I guess my question to you is twofold. What's the strategy for staffing up so that we can actually provide a provider or two for this other operation? And ultimately, what's in it for us financially? How do we make sure that this isn't going to be a money loser for our district?
So, that's the biggest problem right now, like you just said. And I said earlier about, taking volume away from our existing clinic. That's the biggest downside right now until we have additional staff. We definitely would have to have, we really need to have an additional physician really to make this work. We could have Dr. Mongar at both sites, periodically, and all the providers would probably rotate between the sites until we hired additional staff. Right now we have, I think I'm working with 4 recruitment agencies for both physician and for advanced practice providers. We've shown that there's a lot of need in the clinic. We have my schedule right now, because I'm in Colorado right now, and when I come back, my schedule is full for about a month, and the other providers are really close to that too. So, keeping all of our schedules full is a big thing, but we would be losing volume at our existing site. I think that the PPS rates that we've received in the past, for our existing clinic, very lucrative. I don't know, Dave and Tim can, if I don't know if Dave's still here, but I believe our rate right now is about $285 a visit, which is, very significant. If you were an individual physician opening up a clinic, there's no way that you could get that from any commercial payer or Medicaid payer. So, we can make it work. It would be if we can see that this is a good long-term solution, then it may be a good idea to proceed with something like this. And then just keep working on filling provider spots in both sites. The way that the district is kind of open to our recommendations, because they talk about potentially building it out for us, and then we lease space from them. We could potentially do our own project adjacent to them, but the whole idea of the bringing the services together, and it would be a lot less expensive, in my opinion, to do the the collaboration with the schools. Even things like for Carrie setting up the IT, the IT portion of it, or the internet connection. The school would already have that, and we would just kind of piggyback on that. All of our electronic records would just kind of just remotely connect in. So there's a lot of potential for providing new good services, but there's potential for some struggles with it too, financially, stretching staff, etc.
I just don't know how we could commit to it until we have the staff on board to actually do the work.
And I have already made it very clear to the district that we aren't jumping in with both feet on this. We're just exploring options. And, I'm on the school board now, so I need to make sure that, we're watching out for the school board's interest as well. So, and it's something that could come out in phases. So potentially maybe we aren't ready now, but we could see ourselves, participating in the future, and, we could proceed that way.
Greg, the school, they're raining money on the school. They are pouring it. Hasn't always been the case. And you were on the school board before. You know what I'm talking about. A lot of it is grant based. And we have had an excess of money in California. Next year, we're going to have a deficit. We're going to need money. So a lot of that grant money can dry up. We could be in deep shit. Now, as a hospital itself, we've been on our own. We stand on our own 2 feet, and we're not reliant, except for the $285 per visit. That's a little bit of a help to us, but no one seems to think that's going to change. But we should watch financially. We want to provide best service we can to every person in the community, but financially, we need to try to protect ourselves. I think.
I definitely agree. And, whatever, we're still just kind of investigating, looking. There are potential ways that, and that's where the government financial services kind of comes in, because they're basically a financial consultant for schools, school districts. I think that they do some healthcare facilities too. Ross, you worked with Lori in the past when we were going out for lawns, for the bonds in the past. So, I just want to make sure that everyone knows that this isn't something that we're committed to, but has potential great, there's just a big potential for the community and for us. And honestly, my fear is that if we don't do something, then someone else is going to, because there's just too much need in that. There's too much need in the Lake Isabel Bodfish area. There's just, Omni can come in, Clinic could look at it, opening additional sites. I'm not sure what everyone else's plans are, but this is maybe, possibly an opportunity.
We've talked about it from a strategic perspective before too, that we know that at some point we're going to outgrow this clinic. We've known that for some time. We're pretty much there now. And so, we've talked about the fact that at some point in the next couple of years, we're going to need to find another site. to provide care, that we've always looked at Lake Isabella as that potential area primarily because there's a bigger population base down there to support it. So, I mean, it makes sense, obviously, if we can do that, if we can piggyback this on and get some benefit from the school district and the consortium here, that would be great, if we could do that. Obviously, staffing is going to be an issue, again, and it's just something that we're going to constantly be looking for. And I know Greg and I have gone round and round with trying to find, these recruiters to get in there and try and find some people for us. They are out there. It's just, you just got to hit on the right one. And so, like I said, hopefully, we'll have a good interview with this person coming in. We've met with a couple folks already and so forth. So, like I said, I think it's something that we're just exploring at this point in time and just taking a look, does it make sense for us to be a partner in this or not?
Yeah.
I think right now it does, yeah.
And if you want, I can come back at the next, to the next building and planning and kind of update on, what we've seen for sites. And because hopefully we can do that and have another meeting with Lori and Government Financial Services, and she can kind of tell, based on our level of interest, there's ways that they can restructure debt. They can, there's a lot of creative ways that they can draw on their resources by having a long-term lease with us, and that sounds really promising. But so I can, if you want, I can update at the next meeting.
I think that'd be helpful. It's Greg.
Hey, Greg, could I take a couple of minutes and kind of explain to some of the newer board members the issues related to buildings?
Sure.
Okay, so the challenge that we have as a hospital, if it's a hospital licensed clinic under CDPH, it falls in a different category than, say, if a physician who comes up here and says, I'm going to open a little practice. He can rent a building and he can use a building that's got inefficient air conditioning, Romex wiring, plastic pipe, etc. We can't. When it's under the hospital's license, the current clinic that Greg has is grandfathered because it was in existence before these rules and regulations from HCI went into effect. When we did the expansion, I had to go down and meet with licensing and literally beg them to allow us to expand the clinic and not bring it to OSHPD 3 because we would have to shut down the clinic for an entire year in order to do so. Understand that if you take an existing building, all of the drain piping is in plastic. HCI requires an OSHPD 3 building to be in cast iron. So you got to saw cut up all the drain lines for all the sinks, for everything, all has to be put in cast iron. All of the wiring has to be in EMT. It cannot be Romex like residential or commercial. The air conditioning systems have to meet basically almost hospital standards. They have to have 95% filtration. So you have to put in all new air conditioning systems, all new ductwork, all new everything. So that's why it's almost better to start. The idea of using that lot next to the thrift store where that physician's office is could work, because if you can get the county to allow us to merge the properties, office functions of a clinic can be in normal type construction. But then you would do an expansion off to the side for the patient care services area, in which the draining would be cast iron, the HVAC system would meet the requirements, the electrical would meet the requirements, but yet you could utilize that existing building for waiting room, possibly, and or the office spaces for the physicians and staff to function. So just so everybody understands that, unfortunately, there's not a level playing field between a physician licensed clinic and a hospital owned licensed clinic.
Yeah, we were looking at, if we did something like that, like a modular type thing that already meets all the requirement, is built to meet all the requirements, and also can come in modules. So that would be, that would be nice.
Yes.
Greg, I just had a quick question. Didn't at one point the healthcare district have a clinic in town? Wasn't it Dr. Close's old building, or wasn't I think all that was shut down when Brim took over?
We ran the building that Clinica Sierra Vista ended up taking over. It was actually a BFMC building, and then we were managing it for BFMC, and then relationship kind of frayed away, and it was never a rural health clinic. It was basically a doctor's office.
And then wasn't there a clinic also in Kernville at one time?
Oh, that
Yes.
disastrous.
That one.
Yeah. Oh, okay.
Catherine, Fred, any comments?
No, I'm just
Um,
interested to see where it goes.
I'm interested to see where it goes also, and want to bring up that Gene's been asking about getting a different clinic or something going on in that area for a while, so I think that would be good.
All right, Greg, we'll hear from you next month. Thank you so much for the info.
Sure, thanks.
Okay, any other comments on that item before we move to adjournment? All right, gang, then again, I apologize for being late. I was just enjoying the day. I forgot there was a meeting.
That's good.
So we will see you in a couple weeks. What's the date of our January meeting, Heidi?
12th? Wait, 9th. I lied, it's the 9th.
The 9th. Okay, we'll see you
Yep.
January 9th. Thank you, everybody.
Finance tomorrow, so.
Okay, thanks, Jim.
Thank you.
All right, Happy New Year, everybody.
Happy New Year's.
Yeah.
Bye.
Bye.